The threat of COVID-19 is real for paramedics like David Leary. It's something that runs through his mind every time a call comes in.
Basically what paramedics have seen in the last few weeks, just an increase in calls that we call influenza-like illnesses and or COVID-19 like suspected.
The number of infected people in BC climbing each day. People who are afraid they're experiencing symptoms now make up 75% of the calls directed at paramedics.
We have to take the precautions and wearing all our proper protective, personal protective equipment, which is quite onerous to what we call don and doff, which is to put it on and then take it off.
An influx of calls amid a global pandemic, taking a toll on the mental health of those workers who get dispatched.
Due to the seriousness of this disease and the seriousness of spreading it and contracting it yourself and possibly taking it back to your family members and or spreading it to your coworkers and through the general population, we obviously it brings a lot of stress upon us and I'd say anxiety and yeah, it's a difficult time.
That's why medics are urging British Columbians to follow government recommendations by using things like the province's self-assessment tool or dialing 811 instead of 911 if it's not an emergency.
So that if you or not have an emergency or just looking for support or advice or guidance, those are the first places you should be going to.
Not doing so could put an unnecessary burden on an already strained healthcare system.
And potentially could make resources or ambulance or paramedics not available for somebody that does really need it in an emergency situation. So we're just trying to get the right help to the right people at the right time.
An urgent warning from those on the front lines who expect more and more people will need their help as this public health crisis rages on. John Hernandez, CBC News, Vancouver.